So good morning. It is a few minutes late, but we're waiting. Dollar, he was on his way, but traffic in Atlanta was a problem due to the weather, I think. So, but he should be, I think he's online, but he should be here too in just a minute. But I'm gonna go ahead and call the meeting to order and ask Gabby if she will to establish a quorum for us.
Is Marty Robinson present? Jeff Adams?
Here.
Pete Quinones? Lee Oliver? Blake Thompson?
I'm here.
Wayne Montgomery?
I'm here.
David Edwards?
I'm replacing David Edwards. Alan Edwards originated.
Sam Polk? Vic Drawdy?
He's here.
Huey Atkins?
I think he's here too.
You did?
We saw him.
Yeah, we did. I saw him in the hallway.
Jim Atkins? James Smith?
Present.
All right, we have a quorum.
Thank you. So the first thing on our business is the approval of 2 sets of minutes of leave. You should have gotten them electronically, the minutes of April 21st and the call meeting of May 24th. I would entertain a motion to either amend those or approve those.
I'll make a motion. I'll read both of those sets. So.
Have a motion to approve.
I'll make a second.
Have a second to approve. Any discussion? That discussion? Maybe not. We tell who that is? Well, hearing no coherent discussion, I'll call the question. All in favor is aye. Any opposition, same sign. Motion carries and minutes are approved. So Liz, you want to give us the Georgia Trauma Commission update? Is that next?
Yeah, the only updates really is just, we're finalizing everybody's amended contracts as well as the start of the new fiscal year contracts, FY 2023. And we're already preparing for FY 2024. And one exciting part of that preparation is that I'm working to establish the Georgia Trauma Trust Fund, which is the fund that our monies, the super speeder monies, will now be deposited in. So hopefully that will be done by Friday, and it will change a little bit the way our monies are used. So more to come on that. But
That's your report. Would you tell them where we're at with level 3 and 4 stuff? That's kind of near and dear to my heart.
oh, with the
BCS consult?
and the PTSF visits,
Yes.
that sort of thing. Oh.
I think they might be interested in that.
Oh, 2 things about them. One is the readiness costs. I think I told this group that the readiness cost survey that we did for the level 3s and level 4s was accepted for a main podium presentation at the American Association for the Surgery of Trauma. And it's quite stunning that it actually got accepted because, you know, it's a big sort of starchy academic organization. There's over about 700 submissions and only 60 are accepted. And readiness cost surveys are certainly not the most, you know, academic topic for folks in that realm. But it just goes to show that the fact that they want to hear this information is that there's a real thirst to understand the level 3 and level 4 trauma centers, those in the rural areas. So it's really encouraging that they want to hear about this experience and what our results are. So with the main podium, we also have to prepare and submit a manuscript on it. So it's essentially automatic acceptance into the Journal of Trauma and Acute Care Surgery, which again is another thing that's really hard. That journal has a really high impact factor for those of you, Tim, you might be aware of that from your PhD days from the impact factor of academic journals. So it's sort of the go-to when you want to find out trauma, clinical topics and clinical information. So we're really excited about that. Huey knows it's made my life a wreck because the manuscript is due. So trying to get together all the information on that, but once that is all adjudicated by the end of September, I'll do a formal presentation to this group of what it has to go through that first. They have a really strict process. So once it's all through that, I'll share that with you guys because we learned quite a bit from that process, as well as now we have an infrastructure built for the level 3s and level 4s to sort of tackle problems through that level 3, level 4 rural trauma committee. So it's a great group. We have lots of engagement, Courtney, let me say. I mean, we have 2 rural surgeons, Dr. Greg Patterson and Alicia Register. Greg Patterson is at Archibald and Alicia Register is at CRISP. And, you know, they're really passionate about it. So we're very fortunate to have their leadership. And then the level 3s are going to be required. Are required to for funding to have ACS verification. We have had to push that back because the ACS asked us to. The requirement, it was going to be by June 30th, 2024. So we pushed it back to June 30th, 2025 because they're having trouble completing their consult visits. And the consult visit is not always, but usually the first step in achieving ACS verification. And because those consult visits have had to be pushed back, it creates too tight of a window to try to fix those deficiencies that you may be sort of given at the time of your consult visit in order to be successful for verification visit. So we don't want to create any jeopardy situation. And the whole goal of this is to make folks better anyway. It's not in any way punitive, but as I learned in my previous life, unless you have somebody from outside your building come in and tell leaders in your building what you're doing wrong, there's not a whole lot of incentive besides financial incentive to fix things. So we keep learning more and more as the level 3s go through that process. And then because the American College of Surgeons does not have a process for level 4s, we have employed or contracted with, not employed, the Pennsylvania Trauma System Foundation to come do a similar process for our level 4s. And that'll be done the week of October 12th. There's 6 level 4s that were eligible at the time that we contracted with PTSF to do this for us. So they'll be visiting those 6 centers. And then it works out really nicely that the November commission meeting, which is November 17th, coincides with World Health Day. And the chairman of the board from Pennsylvania Trauma System Foundation, along with, who happens to be one of the surveyors who's coming, along with one of the nurse surveyors, are going to do a review of aggregate strengths, opportunities, and recommendations for the level 4s after they look at our 6 level 4s. So they've done a very intense educational session with our level 4s. They've done webinars for them where they can really, because I know some of them reached out to me about educational courses because now they know, like, oh, there's actually some requirements that we have to adhere to. So it's quite exciting. And incidentally, the American College of Surgeons released their new trauma center criteria in March or April of this year, and they completely omitted the level 4 criteria. So they recognized that was a good move. So they put together a rural committee, which actually consists of rural folks. It used to be like rural academic medical centers, like Mayo Clinic used to have a real huge presence in that. So they realize now they actually need to have people who actually practice in the rural areas really sort of drive that. So very encouraging that they have started that, and that group will largely tackle. We don't know what it looks like. We think they'll probably revise the book. They were hoping to throw this book out there and then not make any revisions to it, but it's clear that's not going to happen. So we don't have a timeline around that, but for right now, we continue to use the Orange Book criteria, which is the 2014 version of the American College of Surgeons Optimal Resources for care of the patient.
So the conference call we were on the other day, I think that's with the Pennsylvania folks. Is that right?
Conference call. I have so many calls with you. You and I live such parallel lives these days. Which one was that?
Just, we're parallel going someplace.
Oh, that was the American College of Surgeons. Yeah, that one.
We might be parallel, but you might know where the hell we're going. Sometimes I'm not so sure.
Oh,
But
the rural focus visit.
yes,
Okay, that's
so
another
the
thing.
rural focus visit, those folks are trauma center folks. And I was pretty adamant that I want to make sure that as they come down to the rural communities and look at what's going on there, that they involve EMS, because transport is becoming a larger issue than it used to be, at least in my opinion. At least what I'm hearing, and that's old business, I think, or maybe new business, but I'm not go too far into that right at the moment because I want to talk about that. Particularly, it's up under the old business center funding.
Oh, okay.
So
But what you're talking about, I'm sorry, is something different. There's so many initiatives going on right now. That's why I wanted to draw it on, but now you just made me do it. The American College of Surgeons Trauma System Consult is something entirely different. That will be in January, but it will be with a rural focus. And yes, we've had several calls with them about sort of creating a framework about what we want them to look at. And then they're going to come have stakeholder meetings, and they don't, they need to hear from you folks in the rural areas. They don't want to hear from Courtney. They don't want to hear from me, Dr. Ashley. They want to hear from people in the trenches actually doing it. So what we'd really like to do is make sure that there's a meeting, stakeholder meeting set up sort of on the north end, and then one or possibly two, maybe southwest, southeast, since there's such a huge distance. Maybe you can help me with that, figure out what's the best. So much more to come on that, probably more at the November commission meeting. Renee and I are working on how we'll craft like a pre-review questionnaire, because a lot of what they will ask at the stakeholder meeting has to do with what they read in a pre-review questionnaire that we fill out information to give them about what our state looks like, how it functions, where, what are the challenges for EMS? What are the challenges for the trauma centers? Do we have enough trauma centers? All that sort of stuff.
So the point I'm trying to make is a need for you folks to go back to your regional councils and tell them about this. In Region 3, maybe not so much, but in the other regions where they have a good bit of the services are rural, I want y'all to think about what your issues are as far as improving trauma care, so that you can bring those issues back and those ideas back to this group. Because we need to make sure that the EMS community is heard about the challenges of what we have to do. Is that reasonable? I don't want anybody to get caught flat-footed. I want y'all to know about it, know what's coming down the pike, so that some folks can come and talk to these folks from like Liz's point, the folks who do the work. Anyway, more to come on that. More to come on that. Any questions for Liz? Tim, I think you're up next.
So I can, where I can see. So how do we move slides this morning?
Tell Gina.
I'm your slide mover.
Okay.
Just say yes.
Yeah.
Are you working on which one?
I think you're working on Gina's computer, I think. Is that
You wanna
right?
do it yourself?
It's easier if I can do
Hit
it.
download and get it from the downloads
Okay.
folder. It might be easier for you, it might be
I was gonna say,
bigger
you can just do this, and I'll turn the-
or open. Yeah, there you
Yeah.
go.
Hey, while y'all figuring that out, has Auburn come online as a designated
No.
trauma center?
No.
Are they still working on it?
Yeah, my understanding is they're having an ACS consult as well. So.
Consult to get ready to do it, or a consult for designation.
My understanding is to, for all of the above.
Okay. So they're at the end of the process, not the beginning. In theory. Okay,
Theory.
yeah, okay.
This is,
That'll be
this
a
is the
big
one
gap.
that Katie had, right?
Yes.
Whichever computer.
Hang on.
that
I'm
had
gonna
Katie.
get this
Yeah, I sent it to her last
sit
night.
down.
You want to hear?
Will it just open, Gina?
Now it wants me.
This is the updated version.
No, it wants you to log back in to Box. See, it's like, once you just click open the PDF.
You want to transition over to it, so you can.
Okay, well, I'm glad it's not just me. I was like, where is it?
Oh, it is a PDF.
Yeah, so that's it.
A lot more screens in here than what I thought.
They're everywhere.
Yeah,
They're everywhere. They're everywhere. Okay. FY 2022-4. Next slide. All right, these first three slides just really talk about the various deliverables at time that I spend talking with the various agencies about different kinds of problems that come to me about it. And you can see a number of things there. They've got to activate SIMs that they get for their computers, or they've had some that we've discontinued or deactivated, and they need to get them reactivated because they finally got an ambulance fixed and bringing it back online, or whatever the case may be, those sorts of things. And then as counties added to the ABLS, Calhoun and Terrell County are new counties coming on there. Chattahoochee is going to be a new county as well, because most community has moved out of there. Camden County is I think we're waiting for a final approval, but it looks like they're coming back on as well. Long County, we're in discussions. I'm not sure exactly where that's going to go yet, but I think it's going to, it sounds somewhat favorable. And Atrium Health is all back online. So we've added a significant number of ambulances in the Macon, Middle Georgia area there that have been offline for a while as a result of all the acquisition and so on and so forth of Madison and Atrium and changing IT departments and such. So they're back on. So, AMR software up, coordination, troubleshooting. My unit isn't online. I don't know what's getting. I'm getting blinking lights, but nothing's transmitting. Whatever the case may be. That's it. Next page. So this similar ABLS, and then I'm checking up when I see in the AMM that units have been offline for more than 60 days. I'm calling and checking with people or sending them emails and checking with them about what's going on. If there's any help they need to get them back online, whatever that. So that takes time in doing.
Just in general, what are you finding? Why are they not online for 60 days?
Well, in most cases, it's because the truck, there's something wrong with the truck and it's offline, it's in the shop or it's been wrecked. You know, I'm sitting talking to Ware County the other day, and we got them all running, and they're running 7 units all the time. It's looking really good. And all of a sudden Perry says, oh crap. They had a medic sitting in the truck outside the hospital, while the other medic was in the hospital with a patient. Somebody came flying up to the hospital, or in the hospital to get somebody to help bring his patient out of his pickup truck. And the patient reached over and got the driver's seat and crashed pickup truck right into the ambulance. Put it totally out of whack. So that's the kind of, those
Is
are
it
the,
taking longer than usual to get ambulances back when you,
They can't
Yeah.
get parts.
Can't get them.
Can't get new ones, you can't get parts.
so it
It's the ones you
becomes
got.
more critical for preserving airtime funding than to ensure that if something does go down, that, you know, parts delayed, we probably need to.
Yeah.
You had a term for that, like we could disable it or
yeah,
something. for certain-
I basically at this point, if they're aren't on there at 60 days, I deactivate them. And then when they get them back, they call me and we turn them back on. It's typically not an issue. We're gradually learning how to do that.
When a provider is no longer a provider in a contracted zone, are those units disabled?
Yes. Yes, absolutely. They're disabled and deleted from the AMM.
What do we do with the emotions?
Pardon me?
What do we do with the hardware?
Well, we haven't had any issue with hardware at this point, so.
No, is it returned or is it just stay in
No,
the?
it's not returned. And the ones where that has been happened in the past, were all OMGs, so they're out of, they're not usable anyway, they're boat anchors.
But that is a good point going forward.
Going forward, if we have any transition, we can pull the units out. Basically, what it means is that unit can be reused. We have to buy another $275 antenna and another $85 pigtail,
Right.
whatever, to put it in another ambulance someplace. And pay that freight back and forth across the state or whatever to get it where it needs to go.
Those devices could theoretically stay in that county, in that zone,
It could,
just go to the other provider.
we did that, actually, we did that with 7 units that went from, I think, I can't remember, it was Banks or one of the counties there was a misshipment and they received a whole bunch of 7 units that weren't for them. And we redistributed those around the state and got it out. So we can do it. It's just a matter of, haven't had any serious need yet. So those are the kinds of things, other things. But the majority of the units offline, it is because of some kind of maintenance. If they're off for more than 60 days. Sometimes people will rotate trucks online and offline for shorter periods of time, but next slide. Okay. So when they need equipment, we get the orders in or replace them, ordering SIMs from the carrier. If they need equipment or SIMs or whatever, they come through me. I place the orders with ITS. That way we have a track record. We have a shared spreadsheet. We track everything on plus whatever. Then invoicing comes to me for approval and then goes to Liz and then Gabby and Katie to get it paid, whatever the case may be. And so that's how we handle all that.
Just a curiosity question. Courtney, where was it that, I guess a year ago, the ambulances caught on fire in the building? Is that Alma Bacon?
Jeff Davis.
Jeff Davis. So
They
did
got
they
their,
have OMGs in those
they
trucks?
got their, did they? No, they had never been in, they'd never been in the program, but they just got their new trucks this week, or last week, that last week, or this week. And they're ready to put AVLS in them as soon as we have funds to buy the units. So.
If they had them in there, was it their responsibility to replace the ones that were destroyed?
Yeah, under the current MOA, that's the way it is. Unless if it's covered under warranty, Sierra Wireless might cover, because they have covered 1 or 2 that were damaged by water initially, when they were very young. But there have been a couple that have been water damaged that were older, and they said no.
So is that a scenario where we can get some of the MG90s from a county that a provider is no longer covering?
It would be, it's not currently, but it would be, yeah. That's potential that we could do that. Some of them have literally turned their trucks over to the new provider and done it that way. Others haven't.
So how many folks are you seeing, because we're talking about the window of opportunity to change a carrier, we got to set that window. How many folks are jumping back and forth between carriers?
We had quite a few last year, in the first part of this year, but it seems to have stabilized out at this point. Who really wants Verizon, who really wants FirstNet, who really wants SouthernLink. SouthernLink's been aggressive about getting units, as you'll see when I show you the numbers, and they've converted a lot of Verizon units. FirstNet was very aggressive early on, but they got a couple of agencies and then lost it, and who went back to Verizon, and since then they haven't been so aggressive in terms of getting their FirstNet system in. T-Mobile has got a few, but not there. They all have a warning order. They know that this window of opportunity situation is coming. And we were chatting about it the other day that maybe the first quarter of next calendar year, January, February, March might be an opportune time to do it when it's away from our year end and year beginning sort of situation. So anyway, so those are the kinds of things that we're doing that keep me busy and responding. And the idea here is trying to respond to people quickly when they have an issue or a question, and you can get them quick response, because they don't always get quick response from the manufacturers when they ask for help. So a lot of my job is running in between there to make that happen for them. And I think we have a pretty good reputation out there with folks now about being able to, about keeping their stuff working. With most, there are a few who, they don't send smoke signals. Okay, next slide. So here's general picture right now. Across the whole state, we got 1,212 active units, 13 out of 1,394 on the EMM right now. 87%, that's 87% of those units are up and running, which is not bad in terms of downtime of units at the end of last month, or more or less the end of last month.
You may want to update your latest edition date down there.
That was the quick reference guide was actually we have a quick reference guide that we provide to people when they first get the units, and that's the latest one we have. That's one of the deliverables that we have. It's probably due to, well, it's still active for right now. So, and then you see the map. Start at the top with what the situation coverage of the whole state is. Lumpkin County up there in the top has a recently purchased Cradle Point system for all of their public safety units, I guess it is. So we're talking about whether they will also possibly put the AVLS in their systems. That's not real encouraging right now. Bartow County has a countywide system that they've had from the very beginning. We still use. And we have a meeting next week with AMR and DeKalb Fire, because their usage has just dropped off for a whole bunch of reasons over the last year, but we're in the process of getting that turned up and turned on. And so they've set up a meeting with us for next week, and we'll deal with that. Gwinnett has always had their own system. Muskogee County Columbus Fire is partially covered by community. Still have to get Columbus Fire. So, And Chattahoochee County, just, community just moved out of there and Chattahoochee Fire took over. And we're talking with them right now about, I think they will probably come on board here as soon as we have money to buy units as well. Down there, Jeff Davis County never has been a part of the program, but they had a fire and lost ambulances, and they just got new ambulances. And talked with them last week, and they've agreed we're going to order units for their 2 ambulances, and they'll be part of the system going forward. And Camden County has had a change in leadership, and the new leader down there is also very interested in being part of the system. I sent him the information. He's talking with his county commissioners about it, but he said he's a strong advocate for it, wants to do it, and so I expect we'll bring Camden County on shortly. Long County is Excelsior Ambulance, and they're busy expanding, and I'm busy chasing them from phone call to phone call to try to get some possible commitment from them to go up the system. So that's where we stand with all those. And then Walker County also just changed over, and now CHI Memorial has Walker in Dade, and they have trucks in Dade because they took them over. But the Walker County ones, they've got the trucks they've got in Walker County don't have units, but they definitely want to be part of the system. And so as soon as we can get units for them, they'll come up on there as well. So we'll have all of those covered. So that's where we stand at the moment. Unless you know of anything else I haven't been able to find out there. 150, I finally have a list of 159 counties, and I just go down that list, try and check them out. Any other questions on that? See, Region 5 looks pretty good now when Atrium comes online. Oh. Okay, next slide. These were the ones that we sort of talked about already: Bartow, Calhoun, Camden, Chattahoochee, Muskogee. There.
The layer y'all using,
Bartow's actually on this. We've got a service delivery contract there, so we're on there. It's their ambulance they have on the ambulance license. I guess it's not on there.
Yeah. So it's not like
one
they're.
vehicle,
It's
It
not
may
like.
be 2. It's 1 or 2.
but I think they changed that where they don't have to have an ambulance.
Right, right.
We had to do that years ago. That in.
So should we? Are you covering their entire 911 contract? Okay, so then we can color them the right color.
City and county.
I'm sorry. It wasn't Bartow anyway. It's Cherokee.
I can't help you with that
I
one.
wrote the wrong name.
Cherokee, you're right.
Honestly, I don't ever remember seeing Bartow up there
It's
before.
a Cherokee. It's
Yeah,
a
I didn't
Cherokee.
look at the map, so.
It's the Cherokee Sheriff.
Yeah, I give you Nate's telephone number.
I'm next door to him.
I
I don't
can't
know.
help you with it, so.
Is there a Calhoun County or is that Gordon County?
There is a Calhoun County.
Yeah.
Yeah. Gordon County is online. They're part of the Adventist system up there. All right, next slide. So currently with Verizon, we've got about 561 units. We're paying for AT&T 168, T-Mobile 74, and Southern Link 451. 1,254 units out of all of them that we've been paying for.
Well, suddenly really has come back strong.
Yes, they really went out there after it.
Is that Amy doing that?
Pardon me.
Amy?
Ken Mobes.
And you're done.
Oh, well.
We're back.
So, and videos and stuff for Calhoun County, Carroll County, Clinch County coming back up because Gold Star, Gold Cross, Gold Star, right? Is taking it. And we're in the slow process of getting installed in their trucks. But that's okay, next slide. And so we purchased with the last $25,000 supplemental that came out of the supplemental budget last year, units, those units for Raven that you see there, including the 2 for Calhoun and the 2 for Carroll. And 128 others that had been purchased. So over the previous 3 quarters. So the total funding last year was 141 gateways for the sorted antennas and cables to go along with them and their replacements. Next slide. Here's what we budgeted going forward. Initially, we had a budget $100,000 for equipment. Well, $150,000. Somebody gave away 50. But we have $100,000 for equipment, and then annual maintenance was 181. And I discovered in looking at the quote that they had put tax in there, and we took the tax out, and we're actually we got an invoice for 167,000, and that's what we're paying. So, and then you see the airtime on a monthly basis and the annual total about almost $600,000 for all the units. And our grand total down there for the year. What I can tell you so far is of that $100,000 equipment, we are now 20 days, 21 days into the year quarter, and I've already committed $34,000 of that $100,000 that I'm just waiting for a purchase order number to order units that are outstanding, and there are more that I know of out there that we need to order. So if there's any way to squeeze any more money into that equipment budget, I appreciate it. It'd be helpful. Anyway, but that's where it stands right at the moment. Next slide. That's it. Okay. Questions?
Questions of Tim? So can you put that last slide up? Back up, Jim, sorry. Slide 9 of 9. Because there was some question, I just want to put it out there. I know Katie and Tim and I had some conversations. We had budgeted $181,000 for annual maintenance. And when he took the tax off of it, we found out that we had some spare money. If I say something wrong, please tell me. So the concept is we can perhaps put that money that was allocated to taxes into buying equipment. Does that seem right?
You had this, what do you say, you had it at the original quote, and it had sales tax on it, so once we took the sales tax off, it went to 167, so that's, what was that, 14? Yeah. 14,000.
Quick addition.
I was trying to calculate it, but Huey's right there.
So I don't know that we need to have to absolutely make that decision today, but we all look at it, and if that's solid, and it looks like we're gonna be good, then I don't mind moving that over to equipment. But I want to make sure everything is solid. I don't want us to go out on a limb and.
Would you like a motion that says if there's a surplus for the annual maintenance?
No, I think I just assume bringing it up as old business next meeting. Is
Well,
that,
do you need it for the purchase order process now?
It depends on how quick Tim, if Tim needs it now instead of waiting on the next meeting.
No, I can, there's enough in there now, in the 100,000, I won't spend all that this quarter, but
so let's do that. If we can put
There
that
might be a
under.
little bit more that we could do with the ADLS airtime with the purchase orders. So we could potentially have a little more. So I'd like to get all those numbers
Yeah.
together
So
between this change and that. And then-
yeah. So there's nothing, it's not urgent. Right. It's just a matter of,
So if we can,
I know sometimes getting the equipment for you and like the time that it takes is somewhat.
well, and right now, it's really, when I put an order in, it takes weeks. It used to take just a couple of days. Now it takes weeks because of the supply chain. So,
so that works for you?
yes, that works for me. That's fine.
Okay.
So one last thing I'd like to say is, I've been meeting with the RTACs now and talking with RTACs, and that's really helped tremendously in terms of being able to know who the heck has got the 911 contract and who the leaders are, who's changing and whatever. And we just made a big difference in Region 5 this time by being able to bring Atrium back on the fold and some things going forward. And so I appreciate that a lot. I put together this report that is for the 8 RTACs that shows the whole state, and it shows each region and every unit, and it shows every ABLS gateway and the online status for each agency at that particular point in time. When it is, and send that to the RTACs, and we use that as a sort of tool for talking to each other about what's going on out there. And that's been really helpful. And I appreciate that, all that help.
It's our tech coordinators monthly meeting now, and it's just been we're just learning more ways to plug everybody in together to make this work. So we appreciate you doing that too.
So
That's the report that's included in the.
yes, yes.
Yeah, okay.
So Katie, I got one other little sidebar here. You know, we've talked about this window of opportunity, window of change. And Tim brought up January, February, March. Would that suit you if you knew in March as far as budget?
I'd say March would need to be
What we've had in the past is because everybody pays a little bit different for airtime. It's not a whole lot of difference, but it can make a difference in the budget, particularly as you encumber it to one agency or another. So we have talked about saying, okay, you're gonna have, if you want to change, then you change, you let us know in this particular time frames. Medicare has an open enrollment. Every insurance company has an open enrollment. So I'm using that sort of thought philosophy that we have an open enrollment. During those 2 or 3 months, you can change providers is from change your SIM card from Southern Link to T-Mobile or whatever. After that window closes, then we will have set up a budget or encumbrance or PO, whatever term you want to use, to Southern Link, T-Mobile, Verizon, all of them, and that's set for that year. That's what we're going to do for that year. So I'm asking you, what's your
Your panic on her face.
I know.
Yeah,
Well,
I would say by the end of February.
Okay.
Would be.
all
Well,
right?
hang on.
Again, we don't need to know it today because we don't, but I want you to think through it. I'm fine with the end of February.
That's the
You
problem.
know,
Quarter.
I mean, we only meet quarterly, so when we don't make decisions, we're kind of kicking the can a little bit.
Well, I'm perfectly all right to entertain a motion for Katie to set up the end date for the window.
But when we say the window, what we really need, and there's still always would be a few dollars here and there, which Katie is, just so you guys know, she's amazing with this. She just will re-encumber for the next fiscal year if there's anything. Used for July 1 to June 30th. Is that what we're kind of saying? Once you start with that vendor July 1, we want you to commit to stick to that vendor till June 30th.
Or they
Is that
have,
what-
well, the January and February, they could change, right? Is that my understanding? They
Well,
could change vendors.
so here's the dilemma now I'm thinking, because as you're thinking of it, from my perspective, in terms of in the field with the agencies, it doesn't make any difference. So it's really what works for the budgeting cycle.
They have
It's
to
a
offer
state
us whatever the state, like we're on the state
But
contracted rate.
Katie, correct me if I'm wrong, because I'm more than likely hard. But if you encumber $1 million to Southern Link, and then 20% of those folks go to Verizon, then you got that excess money in Southern Link.
an opportunity to change vendors within the year, then that would need to be done by say February, so we could.
Well, no, I
make
think
that
that's what we want to, that's the whole
Okay,
point of
so
this, is
they
to
can't
avoid
change.
that, right? The whole point of this is to avoid that,
Yes,
Just not from my perspective.
or,
from my
From my
perspective,
perspective, from a customer service for our people out there, giving them as most flexibility we can is that if they want to change next month and train the one after that, that's what I'd rather do, because it depends on their coverage and what's happening with their cell provider and so on and so
things are
forth.
changing.
It's
so
not
rapidly.
And that's why I
necessarily
was
a problem
thinking
for a
they
change
wanted
of
to-
rates, it's more about who the money's been encumbered to,
Correct.
more than the actual change in dollar.
Right.
I got you. Okay.
And that was my understanding of why we were gonna do an open enrollment, because we did have people that were swapping through the year.
Right.
And by we got down to the end and we didn't have funds on one PO, we needed it on another one. So we were gonna have just a window where they could change if they wanted to change.
Oh, okay, okay, totally different, okay.
That's what, that was my understanding.
Okay.
That makes sense.
now run that by me again, because
The
I
window
fell
of
off the
January
track
and
somewhere.
February was gonna be so they could change vendors if they wanted to change vendors in the year.
During that window.
During that window, instead of doing it all year long.
Yeah,
and
that's
money
what,
going like this.
now, that's what I want. I want them to say, okay,
Yeah,
you got 3 months. If you want to negotiate, if you're a salesperson, you want to go hit them, hit them.
Yeah.
Now, the problem comes in from where I see it, when does that start? So if they negotiate something in February, and I would think for budgetary thing, it ought to start July 1.
Okay, so they couldn't change vendors until July.
They would have to let you know.
Well, it depends on what you can do. I mean, can you move the funds from one PO to
If
the
I know
other?
by the end of February, I could.
Well, that'll give you enough time before year end to be able to do what you need
Not
to do.
necessarily negotiating, but even if you just want to switch, like Tim's saying. that-
Switch is different than negotiate.
Yeah.
When you said negotiate, I was like, we're not doing anything. with price.
Yeah, that's true, but the individual agency may be negotiating with Verizon or T-Mobile for which one they want.
For coverage.
For what SIM card they're gonna put in their truck.
Yeah.
Okay.
That's what
Like
confused me.
T-Mobile
It
is
doesn't-
trying to
It's
get
not
hold of
about, it's not an issue that you may pay $31 a month to this provider and 30 to this one. That's not a problem. The problem is if they've got 100 people paying 31, that's what they budgeted to go to that provider. And now all of a sudden, if you add a few more or you take a few away, now what the PO for that now has to be changed. That's the issue.
And it was a real issue for us, like what, a year or two ago, when we just didn't have enough money on a PO to pay the provider, so like we couldn't pay. So yeah, I think,
Is that an option?
I think if you go, I like the insurance model like this. I think you may have some one-offs once or twice a year, because I know that our FirstNet coverage in one county used to be wonderful. It sucks now. And so we don't have it on there, but if we had, I could see us at a mid-year point coming going. We worked with them, it's terrible, we want to go back to brand B, basically.
So 1 or 2 a year
Right.
like that wouldn't be a huge.
Yeah, I don't think
issue.
it'd be a lot, but
Yeah.
I just, it's a backup communication source for us, so it's not a problem, but it used to be just great. It is not now.
The main thing is, what is it, what it takes for Katie to be able to make the adjustments before it gets crammed up against year end, to make sure that, one, we can pay everybody, and number two, that we also
For
can get.
example, it was at year end and we were having to make like a $25,000
Right,
adjustment because of people had switched from
right.
different providers.
and just like for a little insight, with that kind of money, like that's when they start getting a little fussy with us about leaving this padding and not wanting us to spend all of our money, because it makes them nervous that we're, gonna commit the mortal sin, which is to go over budget.
So yeah, I would say if we want to have it, I'm good with changes as long as you keep up with that. And you just tell me the number.
Right,
I can do that, but I just would need to know by the end of February. I would say it.
Are we saying that we're gonna allow them to switch carriers up until that window, during that, or just
during,
that time?
during
Like
January,
February.
January and February, they can make that change. They have to, if they want to change, they gotta have it done by beginning in January and end of February. That means, the other part that's good about that is that means that if they're thinking about it, they've got 2 or 3 months to run some tests and everything before the January, February period.
I mean, they can run them anytime during the year.
Right,
Test
exactly.
and compare. but-
You'll probably get your carriers not for the
Yeah.
months of January.
Exactly.
Instead of year round.
And so Tim, the only thing, I know we executed your contract already, but if we're gonna do that, and this is kind of a new process for all of them, we probably need some messaging early and often before that window. So
Yes.
that, everybody understands
Yep.
what the limitation is, and so there's no surprise.
Yeah, as soon as you agreed to what the window is.
Yeah.
Then I'll get the message out to everybody.
So it's 2 months enough, you know, back to December, January, February, would that be a big problem?
December, January, February.
That's up to you guys. Just February would need to be the last.
February, you drop it,
Yeah.
get your work done.
Yeah.
So I'd entertain a motion if anybody is less confused than I am.
I'll make the motion.
You have to tell me what the motion is.
So make a motion that providers have the opportunity to switch carriers for the 3-month period ending February 28th of each year.
Okay,
Is that plain enough?
that's plain enough.
I'll second.
Got a motion and a second. Any other discussion?
And I'll send a Christmas.
All in favor be aye. Any opposition, same sign. Thank you.
Okay.
Can I ask a question about this report?
Sure.
So is this every? And I don't mean to the 100%, but is this what the trauma commission is paying for?
This is what's out there.
Okay.
Right now.
Okay,
Ambulances.
okay.
We're paying for whatever that number is that they have up there. We're paying for 936 units. And we're paying for airtime for whatever it was. 1,200.
And I assume this is more than 900, so,
Yes.
okay.
Yeah.
I know terminology changes across the state, but I see what I think are like ladder companies and engines and supervisor vehicles and
Yeah, and we're not,
Medcom and I see a lot of things listed on here that don't appear to be. ambulances.
right, and those, and we don't pay for those.
Okay,
Some of them have them on the AMN, for example. Hall County has ambulances, well, they don't pay for anything anyway, but they have their whole fleet on there. And that works on the AMN, doesn't cost us anything,
Okay.
but it allows them to do it. Glenn County also has their ambulances, which we pay for, and their fire trucks, which they pay for.
so you still manage what's eligible and what's not eligible?
Yes, absolutely.
So we don't purchase those units and we don't pay
We don't purchase
airtime.
units and we don't purchase airtime.
Is there a list of who doesn't participate in this program of the like 911 zone providers? Is there anybody not participating?
That's what was up earlier.
Yeah, that's what at the
Sorry.
beginning of it.
Okay.
Yeah. Yeah. It's in that report. We're gonna be soon down to a very small number. There it is.
And that top one should be Cherokee. not-
Yeah, it should be Cherokee, not Bartow. And Calhoun is coming on, Camden's coming, as you can see. That most of them are coming on. There's a couple. We discovered that Calhoun and Terrell, I had just lost them someplace. They never had been part of the program. And I knew Jeff Davis had never been part of the program, but I didn't know the other two. And they came out with a request, and so we discovered that they were there. So then now they're gonna participate.
Any other questions? Thank you, Tim.
Thank you.
I'm gonna take about a 5-minute break. Y'all can take a break with me or not, I don't know, but I'm gonna take a 5-minute break. So we'll be back at about 12 minutes after 11, if I can read that clock right. Or I'll be back. I hope y'all will be too.
You're welcome.
So we're back. Thank y'all for your tolerance. The next issue on our next item on our agenda is EMS funding. FY 22. I don't know that do we have those PowerPoint that we can put up, not PowerPoint, but the
Yes.
Excel sheet we can take a look at.
Did you say
FY 22.
FY 22.
22? Okay.
39,000.
Mhm.
What you been talking about?
And we're gonna talk about that, where we're at with the FY 22 funding.
Oh. They have the FY 23, the Jim set FY 23 proposal, or are we jumping to 6?
I'm sorry, I have jumped time, excuse me. Jim said, the Jim said.
Let me go.
I'm surprised that Kathy didn't throw something at me.
No worries.
Thank you, Kathy, for
Everybody
straightening
else.
that out.
Hang on, okay.
We have delivered all of the funds and all the education for FY 22. I've still got a couple more EMR classes and PHTL classes to get entered, but as of right now, we have over 113,000 contact hours for FY 22. Over 113,000. I think that's pretty awesome. For FY 22, we have expended all of the funds with the exception of 39,900 and some change. We have sent a proposal. We would love to present another virtual piece for the Educators Conference this upcoming year. We had 1,300 people participate in that, which worked out to a little over 18,000. And because it was 14 hours per person that anybody could get, and it's about those 14. Yeah, 14. So about 18,000 CEUs that was available for anybody to get, and with the money that we were allotted last year, it worked out to a little over $2 per CEU per person. Is the cost on that. My hope is to really push it out to EMS again this year. We allow nursing credits for all of these classes, push it out to the nursing. I tried to go through last year with Regina, and maybe since Gina's come on board, come over there together, so she can help me reach out to more of the nursing community and get them involved. But as far as the conference itself, we've already got 125 people registered, and I think Mary told me 40 vendors have already registered to come to the conference in Jekyll Island. So we are requesting that the remaining FY 22 funds be put to a virtual piece to be opened up afterwards. What that allows is educator credits. We have educator only track, and those educators need those only tracks in order to meet their requirements for the state. But also when we do this, they're allowed to go back and re-log in and watch the stuff on the provider side. So they get everything that's available at the conferences. So all of this. So that is our request for one place.
So that's a request from Jim, so it has to be a motion from the group.
I'll be glad to make the motion. With the travel restraints that are coming up from everybody, I've heard a lot of bragging about the virtual side. So I appreciate y'all considering doing it.
We appreciate the consideration of the funding. I'm all about getting as much education out as we possibly.
So a motion to allow them to spend that 39,900 some change to support the virtual component of the educator and EMS conference. I have a motion. Do I have a second?
Second.
I have a second. Any discussion?
What is the 39,000 fund, Kathy?
39,000 covers the piece where each of the instructors, they have to do the virtual piece. In other words, they have to stand up. We have to pay them to do the stand-up piece, get it.
So they do their lecture
Yeah, do the
for
lecture.
for the virtual part.
Right, that
Okay.
part, then the platform is an expense, and then the person running the platform is an expense. Airtime on that platform is an expense. So between all of it, it's actually about $45,000 what that piece is gonna cost, so Jim's is gonna chip in about $6 to make it work.
And how long do y'all plan on opening it? You're gonna do it after the conference, right?
Right, comes up after the conference, it's usually open for 2 to 3 months. Then we have the EMS component certificates are generated without any issue. As far as the nursing components, we have to hand create those and email those out.
I mean, next year's a research year. I think it's a great idea to do, so.
You also now can archive lectures that we've not done in the past. And I think we've missed a great opportunity in the past by not filming our conferences and catching some of the great lectures that have been in the past.
Right.
So
The only other piece that we could hope to do right now, the people that speak at our conference are allowing just us to use the stuff. They've never allowed us to use it or pass it over to train because we get written releases from them as to exactly how we can use their educational components.
Some of these folks take that, and go to another state and do that.
Mhm.
So a motion is second, any other discussion?
Say that one time. Say that one time.
If- Right now, the release from these people, the speakers, is for just us to use it. And I get it, because if they allow us to say, okay, Train can use it, and somebody can download it from Train and send it to Wyoming, and then the speaker would gain nothing from their lecture.
Well, didn't you just say we were paying them for doing this?
We are paying them to do this, but we have to have a written permission that it can be used only for us. It's, in other words, it's a copyright thing. I can't take their lecture and just hand it off to you.
But to your point, if you include in that contract, which they're being paid for, it'd be placed on training, it would solve that problem.
If
they
they
agree
will
to do
allow
it.
that.
So why don't we do a great encouragement with these guys about the possibility of being able to train Georgia medics in general? Trying to keep it to a platform like our in the state. I mean, that could be something you guys could push.
And on that, Kathy, we can, we'll put a training on there, we can lock it where it's available on Georgia. So the way train works, is when you create a user account, you have to list your state.
Okay.
And so like if you're out for illustration, if you're in Wyoming, you can't necessarily, you can sign up for a Georgia account, but you would be associated with Georgia. And so we lock it, not all of our trainings, but some people probably don't, and it's available to the nation. So we lock it just for Georgia. So it's only available for someone with a Georgia training per account.
Okay, but I think that's their concern, that if we pass it over and put it on train, then Wyoming can get it, and Alaska can get it.
Oh, absolutely.
And all of a sudden, their speaker fees dwindle to nothing, which, they're protecting their livelihood.
Yeah, they've got a product to sell,
Oh, absolutely.
and they're selling it to Georgia for this extra money, and they're not selling it to the world, so. Any other questions about that motion? And the motion is to allow IMSA to use the $39,900 whatever dollars it is to support the virtual component for the educators conference. All in favor, aye. Any opposition? Same sign. Any other questions of Kathy? Kim's on vacation, by the way. I told her she could cancel and come, and I won't say what she said. All it doesn't do to say. She disagreed with my concept. I'll put that away. Thank y'all so much. This group through you guys do a great service to our profession all across this state. And I know they're trying to work with B. Miller. Melissa, I'll think of it. A PhD lady at AU that we've had some work with. We're trying to dial down to street addresses so that we can give a better, she does really great work with maps and this sort of thing. She's done some stuff with rural last year at the November meeting for on rural trauma centers and where the trauma centers were. So we're working with GIMSA to make sure that as we go forward, that we capture street level addresses, and then we can get better information as far as telling folks what we do, exactly where we do it, and who we're impacting.
Can show you a little bit of it if you like.
Sure.
Yeah, I would love to see it.
There's a lot. I mean, y'all need to understand there's a huge amount of work that Liz and Gabby and Katie and Gina do in the background that we generally don't see. Different groups sees it. But as far as somebody knowing all of it, is not too many folks get that opportunity.
So, what we're trying to work with Kathy is, and this is mainly because, even though things are changing with our funding in terms of the trust fund, will still be expected. It's actually in code that Dr. Ashley and I have to go up and explain to the legislators the impact of the funding. So we're trying to get the best representation we can of exactly how far these dollars are going. And I know it's painful, but like, it's a small price to pay to get a lot of good information that can really drive, ultimately what we want to do, and Richard's agreed to partner with us too, is not only tracking, but driving like a educational needs assessment, so we can truly be data-driven everything that we do. That's really the goal here. So this is kind of how Melissa is starting to craft this. Okay, this is just one quarter's worth of data. And I'll just preface it by saying, because we don't have a lot of street level data, and I'll explain why that's important in a minute, you're gonna see like larger blips. But basically what Melissa did was create a color code for each of the type of course that we do. And then her goal is to take it out and make it so that you can really see the coverage. And you can see that what becomes really important with this, or what really helps us, is that those little gaps, I don't know if you can see my cursor up there. Yeah, these little gaps really start to really elucidate areas where we may need to shift the focus a little bit, right? So once you can see coverage in that way, as opposed to just seeing the color coded counties, it really helps you see. And we want to collect data in two ways. One is, what's your home address? Two is, where is your primary work address? So that we know, like, I mean, many people don't work where they live, right? So how are we actually helping those folks? So, and then here's the first slide. If you look just at Farm Medic, the yellow county colors is where the course is actually held, is my understanding. Kathy, keep me honest here, because I know you work with Melissa on some of this stuff. The dots are where those folks came from to attend that course. Okay, now the dots again are big because we don't have street level, and although street level, yes, they're still going to have the same zip code, but street level does make it, you can really see when you see all those little dots all over the place, like when we do this for trauma patients, and do they go to a designated center or non-designated center, it becomes really powerful when you look at that shadow all over the map. So the one thing this won't show, and I'm working with Melissa about how to fix this, is that when we assign a color to a course type, now of course when we go on Farm Medic, you can't tell who went to that course in that specific county because they're all the same color. So you don't know. I don't know if that's really important. It's probably more important at the outset to know who actually went and where they came from. So then this is the TECC, same thing. You can see we've actually got some folks from Alabama coming to that course, right? And some of them you'll see there's some folks from Florida, I think, right?
Right, because the premise I put on it is if you either live in Georgia or work.
And then PHTLS. And again, most of these courses, we only have like one zip code for attendees. So we don't have the street level. So we'll get it much more. This is the EVOC course. So when you look at this, and again, you know, what I always try to tell my better partner over here, Courtney, is that these maps in and of themselves are not the end all be all, but when you start to look at them over time and where the courses are done, and we have like 3 years of this we can put together, then we can see where have we not done to where have we not done.
Yeah, that's when it overlays all of them.
Yes, that was at the beginning.
Okay.
All course attendees, yeah. But again, once we get more zip code data or more street level data, they'll show up as just a bunch of, and it'll actually translate into shadowing. And then this is really exciting, which is the virtual conference. Kathy had better data on this because of the way people registered for it. Better street level data, so you can see and look at the presence outside of Georgia even for folks.
So that represents in theory $897. Is that right?
Somewhere around there, yeah.
Yeah. Okay.
I'll let you count them.
No, I'll be honest with
I'm
you.
sorry, I'm just being smart.
No, but I'll tell you what the reason I was asking that was when you look at like Region 3, which is a lot bigger than Region 3.
Yeah.
It's overwhelmed. And that wouldn't have been what I expected. I would have thought it'd been more rural, South Georgia.
This is
So,
powerful
yeah,
information.
it is. Yeah.
So what we've created for Kathy is a template. And then we're gonna help her either through QR code, like you guys capture your attendance here. It's a very small thing to ask attendees to do for getting a free course, is that you have to go in and punch in all this information. But we're also, because Dr. B. Miller is, you know, a researcher at heart, she's going to ask like what your role is, whether you're, you know, a EMS leader or you're, you know, paramedic or EMT on the truck, your primary role, and then how many years at your current role and how many years in the profession. And I think those things will give you guys, then you'll be able to understand more about, we can have separate report outs for that. You'll be able to understand a little bit more about who's actually taking the courses.
One of the things I would like for her to put in that questionnaire, because our cadaver labs are utilized a lot by our colleges who are training the paramedics, for the paramedics to be able to get their clinical hours or their intubations and those sort of things. I think it would be huge to know how much of that's going on to support those schools that are having trouble getting their students into ORs and all now to do the intubation.
Quite a bit. Ryan, how many classes have you brought? Ryan brought 2 classes.
So I think that's going on. It would be nice to know that not only that's kind of a positive externality, you know, that was not exactly what the course was set up to do, but it did that. And the fact that now we can find out how many physicians are coming to it, how many nurses are coming to it, because, you know, it's set up, was designed more for focus on EMS, but that particular thing has broadened out a lot. So.
And I think this has, we can expand next year, FY 24, the QR codes to include like a full post course, whatever, so we can start to compile some like generalizable feedback. It might not be so specific at first, but again, I think for you guys as committee members, it really helps you to make those data informed decisions when you have, you know, obviously we won't present all this to legislators. We'll probably pick that map that has everything, or maybe we'll pick 2 high impact, whatever you guys think. Maybe it's EMR, EMT, paramedic training, because we're trying so hard to get more people into the profession. Maybe that's something we highlight, but for you, this granular level detail is what will help you really kind of, you know, work with Joseph, tell him, hey, this is, you know, great. This really underscores everything that you're doing and then helps us really figure out what is our next steps.
Is this the virtual conference and physical conferences in general?
Right, this was last year's 2021.
With Jekyll, right?
It was
Yeah.
Jekyll.
So I wonder if that's related to traffic. If you look at you just draw a line across North Georgia, kind of a diagonal line. And it's just tremendously populated in the northern part of the state.
And I think what we're probably going to see too is like we hear from all over our regions, that staffing is such an issue, they can't let their
Yeah.
staff
Yeah.
go. That I'm really surprised. I mean, I'm interested to see what the conference is going to look like this year. But I would love for you guys to make this virtual opportunity as a priority for our EMS across the state, especially after seeing that particular map. That's amazing to know that many people from Region 3 actually got on the virtual. Because you know, and you know what we've had in the years past is there's been a competition between that conference and our conference, and many people wouldn't come or go because of it. But this is great, Kathy.
I mean, you look at Region 1, it's almost completely full too.
Yeah.
There's a little pocket there, it's
Mhm.
not. Yeah, but I mean, Region 1's just about full, so it's 3's completely covered. So,
But we see it when we go to the leadership conference, we see a lot of people from the northern area. When you come down to the provider conference, then you will see a lot from the south. That's what I see. I see a lot from the southern area. I don't see the same ones in each conference because of the 2 different venues, but still, I believe a lot of them travel.
It could be, and, you know, we try to be as far as our members, the conference rates, we haven't raised conference rates in, I think, 5 years, and I think at that point it was only like $15 or $20. We try to go where the venues, people want to go to the venues. We tried Cobb County one time and people didn't like that, too much traffic. But we try to pick the venues that will work with us on prices, and the reason we left Savannah was they started more like $150 for a gallon of coffee, plus 27% service charge, and then another hotel service charge. Anyway, your gallon of coffee was up to about $180. They're like, I'm out. So we try to, that's the reason that we move around a little bit, is to try to keep those costs down for the members that want to come.
And one other thing, as you look at these things, particularly on some of the NAEMT courses, some of those are limited to areas and it doesn't broaden out because in AEMT, you have to have a approved location to teach the class. And that can be an uphill slide to do it in some of the smaller communities, finding that location that could do that. So what they've done is gone to more or less central areas around an area to try to do that. And if you know someplace else you think they might could do it, please get with Kathy and Kim and they can take a look at it.
And it's kind of the same thing with the auto education class. We're at the mercy of the auto yards because we need 25 to 30 decent cars to cut up, and people are getting real stingy with their cars lately.
Yeah, because they drag them out trying to make them work
We
again.
went up to Habersham a couple of weeks ago and they said, oh, we can get you as many cars as you want. I think we had 10 or 12 that we wound up with. It was people getting stingy with the cars.
They bashed them here a while
Yeah.
back.
Yeah. So
When did we start this, Kathy? When did we start this type of,
This mapping,
Yes.
this is just 1/4 worth that, Dr. B. Miller did. Yeah, and like I said, we just wanted to kind of take a stab at what we knew it wouldn't be perfect because again, we don't have street level detail for all the registrants, but we're working to make sure that for the next fiscal year, Kathy has a methodology that's not reliant on her because she's trying to do the course. It's so hard to do the course plus, oh gosh, hard to do the course and collect all the data and marry it together. So if we can ease that burden through the QR code thing, then this just gives us a wealth of information. So again, besides the virtual conference, what you see here is just 1/4's worth. So imagine three more quarters of that and how much information you'll have access to. Dr. B. Miller could not, she's actually on vacation this week too. She really wanted to come talk with you guys, but she'll come hopefully to the next meeting.
Good.
And she can, we'll have to let's just go with what we have right now. Because what we have for the roles covers if you're a physician, nurse, or student. So we've got all that covered. Let's go with what we have for your contract. And then if you guys have ideas over the year, and she would love your feedback, because this is like, she loves mapping. That is her thing.
So I was, this may or may not be a workable thing, but if you could put a key into so what I would love to see is you do a program evaluation. Somebody takes it, they do an evaluation, say, I like the class, blah, blah. It would be interesting if we could tie that evaluation back to their role and what their role is or why they were there and tie that up. And it'd be just interesting.
Yeah, all that is doable on an Excel spreadsheet because the QR code supports Excel.
so I just understood your addressing because I was gonna say, well, zip code surely would be close enough, but some of those dots will represent more than one group of people. Okay. Yeah, that makes sense.
And you'll just, I asked Melissa, unfortunately, I didn't get to her till she was actually on vacation, which still took my call, but, I was like, would love to show them what it actually looks like if you have all those little dots, because it just becomes the shading that then really keys in on areas of need or at least that's our work to find out, is that truly an area of need or is it just like national forest where nobody lives or something, maybe it's just not an area we need to worry about. And then again, over the years, we can really show how much impact,
I think you may,
longitudinally.
I think at street level too, you may find some departments now that don't believe in their people going out for training.
Mhm.
There are some counties who look at it that way. We do our own, we're not, if you want to take vacation time and go, that's fine. And that might be something we learn by accident.
And if you, I think what'll be important is going forward now with this new information, Melissa's willing to just play with the data any way you guys want. And we can, and again, we can refine over time. Like we could clearly play with this for the next 4 years and figure out what it is we really want to look at and expand.
It's great.
So,
It's great stuff.
Any other questions? Thank you, Kathy. Thank you, Liz. Yeah. So now I'm gonna get back where I was a while ago. EMS funding, FY 22,
We're still on the jump set.
that was all up, okay. All right, so we're through with that too? Think,
I don't think, we didn't review that.
No,
Excel sheet.
the new proposal for the FY 2023 funding.
from Jimson.
Yeah.
Okay, so do we have that?
Ma'am,
So we can look at it?
Just,
Oh, makes me,
Working hard.
yeah, I know. Like, there.
Can y'all see that?
I'm on.
Make it bigger.
Yes.
The second
Look,
column
I
is
get
red
that.
line, is an edited proposal. Don't look at this column, look back over here.
Don't look at which column, Ken.
Don't look at this one.
Okay, got you, thanks.
Look at column E.
Oh. Possible freeze the opinions or something.
Squeeze those and get them out of the way, possibly.
I'll make it any bigger.
Maybe we just want to go through it really quick and just, can you grab column B through C and squish them together? And you just B through C. Oh, that's not, that's what's, I can hide
asking you
your
to-
video.
Yeah, just, yeah, hide.
And C. Oh, there.
there you go.
There we go. Now nobody has to figure out which column. So we went back through and edited a little bit, to try to get down to the numbers. We're still looking at trying to deliver the education across the state that seems to be very, very popular. We brought down the class numbers some to meet what y'all were asking. Down at the bottom, we've asked for some money for some additional courses. As far as the peer counseling, I have been in touch with the state organization that does the peer counseling at the bottom. They have their 4 courses set for this fiscal year, and they're not going to add any more, even at my begging, but Courtney's gonna call and try to beg. They said they'd be more than happy to have the people in their classes. Those classes are free, but they're 5 days long at 40 hours. So if we were to go that route with that peer counseling stuff at the bottom,
So-
my suggestion would be to support.
So I am gonna call these folks, but you probably know the answer to my question. When they get, what is the desire of the 40-hour class? What do they know? What do they do?
You get certified as a peer counseling specialist. So if that way, say something happened in Ware County, if you were a peer counseling specialist, they may reach out to you to go over there. So you become in a group, a contact group, so that you're available for state help if need be. These people from the state, they also respond to these incidents, but if you're willing and you become part of this group, you become a peer counseling specialist after the 40-hour class.
And how many people in that class?
Right now, that's why I was trying to do the conversations and talk to them. I wanted to try to have one north and one south, but they're not willing to add 2 more classes. They're not even willing to add 1 more class in their fiscal year. So my next goal was to reach out to the CISM incorporated people like Jim Mills used to be, and see if they've got anybody that can come down and teach the classes. Our other option with that is to try to enroll people in some of those classes and help fund them with a per diem for.
So they're not even interested in teaching the one that you're proposing.
No, I'm getting calls constantly, and we are getting too many dang deaths.
How many of y'all ever heard of these classes?
Or which class?
The one that she's talking about.
They came up and did one,
What?
they came up and did one in Hampton.
How did you find out about it?
I don't remember.
And we found out about it through chat.
Debbie Chan.
Who was the guy we talked to a couple of years ago,
That was Jim Mills.
Jim Mills.
and he was wanting us to fund his startup?
Fund his startup company.
I think that was here, wasn't it?
I don't remember where we were.
No, that was, we were making some.
Yeah.
Yeah,
Catch you, their class is full with their,
they say they fill up pretty quick. They won't give me, they say, if you wanna sign up, Go to the website and sign up, but they won't tell me how many people in every class. I've got to get a better relationship.
Yeah.
There's a guy, Shane Smith, out of Athens, Clark. He's one of their peer counseling people. He's a firefighter EMT. I might have better luck with him if I get him one-on-one and see if he can get me some information.
Who is they? Who's the group?
It was set aside by the House bill.
It's, I think it might have been a House bill, might have been a Senate bill. Bill Hitchens, I think, was the primary author.
Is it a state agency?
Yeah.
Mhm.
It's under public safety.
Why are they so secret?
Why do you have to pay them?
Well, you know,
No, you can go free to the classes.
but they're 5 days and they're usually not anywhere near you. So I'm just thinking with our people, if y'all would allow, we could give them a per diem for hotel and a per diem for meals. And that would take it off the service back. Now, as far as the time for your people to get away, that would be up for y'all. Because it's a 5 day
But it's
class.
still a 5-day class.
Yes, it is a 5 day class. 4 years.
Classes to teach people to be counselors, not
Correct.
train to train.
Now, you would become a specialist. They're the trainers. They don't train you to be a trainer. They just train you to be a peer counselor.
What is their background? on that?
I know the two people that I met with, Keith and I met with them and had lunch. One was a retired GSP officer, and bless his heart, had been shot 4 times. Him, and then this Shane Smith, who is firefighter EMT out of Athens, Clark. I think there's, what do you say, 7 more of them?
In Georgia?
Yeah, and there's, in that group, there's, mental health specialists. They teach a part of the class. And they just say putting any more classes other than the 4 classes they've already got set would be too much on their backs. Because they also respond to incidents. So the peer counseling, I'm looking at all avenues to get people in there, but like I said, we got too many people killing themselves. I heard of too many last year. And on top of that, we got other people that in our business that's dealing with stuff that's deeper than we all see on the face.
So the money's not for training, it's for housing and. You know,
If that's the only way I can get somebody in a class, I would love to put on a class. That's my goal, is to put on a class and get as many people in there as they'll let me.
I'm gonna try to get somebody to come back and talk to us about
Yeah.
what this is.
It's the
Kelly, do you know
office-
about, what do y'all know about this?
It's the Office of Public Safety Support. Is who's offering the class, which is under, the Department of Public Safety. It's part of the deal.
But do y'all get announcements about this?
So,
Well, I know the bill was designed for everybody.
it's-
I remember the bill.
Mhm.
It looks like they offer it free, like Tony did, I don't know how many times. The class is limited to 30 students.
We have it approved by EMS, they do the approval bill in for their courses that we.
That's what, learning online or,
Yeah, that's the.
yeah. I love learning online, but I think a class like this, personally, I think.
No, give it content.
Thank you, okay. Yeah.
I work with Shane very closely.
Okay.
About getting him set up with what they do.
Cool, so you know Shane.
Hey,
So
Courtney,
I haven't
Yes.
stopped.
Yes,
is this the same program that Captain Scott Dakin was talking about at the EMAG conference?
probably. I won't swear to that, but probably.
Where's he? Is he from Bartow County?
I do
Anybody
not
know
know
him?
him.
I've got his email, but he's got goes and teaches some kind of program similar to the critical incident stress management classes we used to take years ago.
Oh,
So, I mean, that's another avenue. And I know he goes, the group that he's in, they go out and.
I do know that some of the literature I've read is that there is some evidence that, particularly not done appropriately, that this can be more harmful than good.
Yeah.
So what we have voted on this overall budget, have we not? We have not voted on the GIMSA budget at all.
Remember, we took it back for revision, and so this is the revision. Because they don't have a contract. Yeah.
You put it on the amount.
So when we do it,
Voted on the amount, you just haven't voted on the distribution.
so we don't. So when we do a contract, we'll do a contract for that many of these courses? Or do we do a contract, overall contract for training?
No, we do a contract based on, we attach the approved, what you approved, we attach in their contract, so it is specific,
But it can be amended.
correct?
Okay.
Correct, am I speaking?
And so y'all can see what we have kind of set up as far as the proposals of classes. The leadership class 1, trauma skills lab 10, the PHTLS, in our NAEAT classes at 25, paramedic at 10, auto education at 4, the axes of leadership at 3, low angle ropes and patient handling 1, TECC 13, EVOC is 3, EMS instructor is 2 classes, the PSA, the public safety and ambulance, and we've got 1 tag there, but we would definitely get more than 1. EMR ENT classes at 26, Moulage scores. That needs to be changed. It should be 2 at 16.5. When we're getting, that's going to be one of our pre-cons that we offer at the conference, and it's almost full right now. It's going to be a cool class. These down here at the bottom, the junior leadership class, the Georgia EMS Preparedness Foundation funded that class last year. 35 students showed up at it. It was awesome. It was a team out of leadership class number 10. And leadership class number 10 wrote the curriculum. They were the instructors, or they got the instructors. And that class was a really good success down in late last year. We talked about the peer support, the trauma skills lab instructors to include the workshops. The training, we want to get them sent. We figured out with the cadavers, we can actually do burns. We can do gunshots. The only cadaver with that, only caveat with that is we have to take the cadaver out to the gun range and let one of the people shoot it. So we're working on that, but there's a lot of new stuff that's coming out with the cadavers and the specimens that we can work with and teach new stuff. That's why we're trying to get the labs and a little bit more training for those instructors. Send 2 instructors, let them come back and teach the rest of the group. Equipment for TECC, farm medic, and the cadaver lab. Some of our stuff is wearing out. So we've got to replace some of that. The tourniquets for TECC, that's a plus. We've had an actual couple of live saves with those things that we know of and what we don't know of. The tourniquets that we give out to them. That's if y'all want to continue doing that. I will tell you that I had already opened up EMR ENT. I closed it just the other day. I've got to go through them to make sure that they're all legit, but 70 is on the wish list. And of the 70, I just asked a question, if it was allowed to conduct an ENTA course with the same funding parameters as an EMR or an ENT, would you want to do it, and could you get it done by the deadline dates? And about 40 of them replied yes. All of them replied yes, that they wanted to do an ENTA class, but 40 of them said they could get it done by the deadline dates already stipulated.
Well, at the end of the day, I mean, we funded a certain amount of money. And the goal has always had an EMR curriculum. Now, the EMR curriculum changed a bit. But if they want to do an A class, as long as they do the EMR curriculum, I mean, that was the parameters of being an EMT. They get a certain number of money, we want certain outcomes from it. And to me, the outcome has always been that entry level, or EMR, even when we started funding it, wasn't entry level. To me, when we started funding the EMR class, was not necessarily put people in the back of the ambulance, but it was to have those folks who could be there quickly. And then life changed, and you couldn't get enough people in ambulances. So we allowed for people to do this and for a licensure. I certainly don't have any, I don't see an objection if somebody wants to carry it on their own. But my only concern is the pass rate on the A class versus the EMR or EMT class is significantly different. I think to get it to be an A, you've got to have gotten an EMT certificate. Is that right?
Yes.
So to me, I don't have a problem with it. I don't know that we care. Do y'all care?
Of the EMT, I don't know how it's listed there, EMR, EMT, how many of those, of the, I guess, this calendar year or whatever, whatever one you can remember, it's most relevant, how many we get requests for, and did we fund 100% of them, or 80% of them, or good?
No, we get some people, it's like herding cats leave.
Right.
I don't hear from them. I email them, I call them. Then I start hunting somebody that works in the department to get them to give me a call. But what I do for that is if right now I've got 26 funded, I go ahead and award like 33. So through the years, I've been working with Jim since 2014, and it's a number that I had figured out that kind of, oh yeah, we want that. And then we couldn't make it happen. So that one, I usually 26, I'll bump it up to 33 or 34 that I award. And that way, when they come back and, you know, pick on Jeff, when Habersham lets me know in 5 months,
Right.
oh, I'm sorry, we just can't make that happen. I've already got a backup plan in
Right.
place.
The other thing is, again, in the old days, this was a terrible term. These were residual or surplus
Mhm.
monies. Causes us a whole bunch of grief, but we think we've got that pretty much under
Mhm.
control. But again, it's budgeted for X number of people, X number of books. And there's a fixed cost with the instructor and this kind of stuff, variable cost with the books and the jump bags if they elect to do the EMR and not the EMT. So there's some variation. So there ends up generally being some funds left over for the class. And what we've allowed them to do when they have X number of dollars, they can add to that particular bucket.
Yeah, and I'm taking this back, kind of a blending of the MSAC but many of y'all know and see the MSAC minutes. The last MSAC meeting we had, 7 of 10 regions provided a regional report. 100% of the 7 that reported all communicated staffing related issues within their region. So there's only 3 regions that didn't report. I don't know which ones those were. So essentially 100% of the 7 said they've got staffing issues at some level in their region. Enough that it made it to the MSAC advisory board report. So I consider that to be significant. I think the education is great. I love what y'all are doing now with the demographic information, Liz and Kathy. I mean, that's just, that shows you things. I mean, it shows you where we have pockets of challenge, and, doesn't mean they're uneducated. It just means they're not participating for whatever reason. I just like us to see for this coming year, this budget cycle, more on the initial education fund, more for whether it's EMTR, EMT, like maybe you can get in a paramedic. I understand that there are people you're chasing. I'm not so much worried about the ones you're chasing. I think there are people out there that teaching. Richard, if I remember correctly, at the T-Mobile Center, we had a discussion, if I remember right, about some places have a good pass rate, some have. Do we want to keep throwing money to places that don't have a good pass rate? I think it's where the discussion took us. Is that a fair comment? And I don't think we should be throwing continued money, but I think we would identify those if Richard or others can say, Courtney, I'm just gonna pick on you.
You should, because our pass rate was bad.
Okay, well, I didn't know that, but okay, so great example. So Courtney, we funded, wow, Z, lightning
Actually, they started it after I left, but
So.
But I've had conversations with them
We've
about that.
done 2 classes there, your pass rate's X, it needs to be Y. We're gonna fund this next class, what can we do to get you to Y, basically? And then so basically, we not develop a remediation plan, maybe you and your training folks can help with that, I don't know, not committing y'all to that. But I think we administratively, if we're gonna do that, if Courtney's pass rate, and I'm just making a number up, Lord, I hope it's not right, 50% or less, if it's 50% or less, and it needs to be 65%, we give you 1 or 2 cycles to correct it, and if it doesn't correct, then we just don't fund it until you can to raise it up. Does that make any sense?
It makes a lot of sense.
But we've never required national registry as a In other words, you take the grant, all of your students have to take National Register.
Right.
It's like Courtney said, the beginning of the grant, it's just the beginning,
Yeah.
was to get people trained, because we always know that either
To me,
your
it's,
first responders, your volunteers get there.
our
first.
world has changed enough in the last 2 years. I think the focus of this needs to change too. I mean, we got communities that don't have folks driving ambulance.
Well, we had, for Region 10, we had our council and our RTAC meetings, and I've got a couple of folks here with Crystal and Ryan. And I brought this up after our last meeting. And it was absolute focus on initial training. And EMS grants is where the focus needs to be.
So let me do this, because I gotta step down here in a minute, and we may just open it a bit before that, but I'm still vexed, very much so, with the equipment grant. So, I met with a group this week, day before yesterday, of rural EMS folks. And I asked them how many of those guys have taken the post-licensure skills to hang additional units of blood. None of them. None of them. I've never been particularly pleased about giving equipment grant money to counties who have a level 1 or 2 center in their community. I've never felt that was appropriate. We've done that because everybody says, well, it's the only way to be fair. And my smart comment is, the fair comes to Swainsboro in October, y'all come on down. Other than that, there is no fair that I'm aware of in our life. But I'll be honest with you, I have a hard time giving money to support trauma care to EMS agencies who haven't felt necessary to hang additional unit of blood. I'm not asking them to carry blood,
But that's part of our fault.
perhaps.
That's where it comes in. In years past, we have many times discussed saying this is a minimal requirement you will have to get this money. And if you've already met it, then you can spend the money on whatever you want. If you haven't, but we've never initiated that.
And maybe that's where we go with the equipment grant. But now let me ask you this. Metro, you picked on me, damn it, I'm gonna get you back.
Fair enough.
And it's not.
Unintentionally,
I'm just, well, but Cobb County, y'all run Cobb County. How often do y'all make transports from Kennestone to a higher level of care on trauma?
Rarely,
Rarely.
but we frequently do in other 2 counties.
There you go. Here's my point. So if you're in Paulding, I've got Paulding, right? So it would be absolutely appropriate to require them to train on unit hanging blood. I can guarantee you, I can't guarantee anything. Gold Cross with AU there, level 1 center, I seriously doubt they ever transport anybody out hanging blood. And so am I gonna make them do that? Am I gonna make them spend 6 or 8 hours in a classroom someplace for something they'll never use?
But you're talking about two different things, because you're, on one hand, you're talking about trauma care.
Yeah.
But then in the same conversation, you're talking about transferring patients. So there is the initial trauma patients that we're treating in the field, that a lot of services are in the testing phases of providing blood and or blood products
And we
for
funded
that
some of that,
initial trauma care.
and we funded some of that.
Correct.
And I'm certainly not
So
against
even
continuing that.
though, you know, Cobb County has a level 2 trauma center there, and they may not be transferring out, that doesn't mean there's not a need for them to have blood products in their community that they're providing out in the field for the initial 911 calls.
And everybody who is doing that is getting that, okay? I'm just wondering if maybe we take some of the equipment grant money and move it over to initial training.
Well, I think we need to realign. That was gonna be my next thing. I think there's a lot of money that we can realign to initial training. You know, I mean, just notes that I've taken, looking at stuff, you know, and this is just my opinion, again, talking with my folks up in Region 10. The secondary education, like the Axioms, that program, I think that doesn't need to happen right now. The junior leadership, I'm all for it. I just don't think now is the appropriate time to do it. I think that's something that can be put off to another budget cycle. The peer support, all the questions about that you mentioned earlier, I think that's something that needs to be researched a little further to see what is out there before we allocate $30,000 to it. The ropes course, I know there's only one of those, but again, and then the last one, and I know this is a big question mark, the trauma skills labs. I think we need to maybe roll that back to maybe 1 a quarter. And that's a huge chunk of money that can go toward initial education. Again, if we don't get the staffing piece resolved, and as everybody mentioned earlier, people can't even leave work to go take any of these classes because there's so much overtime going on because of the severe shortages that everybody's facing. I think that's where our focus needs to be right now. And as far as equipment grants go, I've been all for it from day one. And like I said earlier, we've talked about it for years of allocating trauma equipment grant money to providers and say, this is what we want this money to be used for equipment grant. If you're already doing this, then you spend the money on whatever you want. If you're not, you have to spend the money on this. And whatever that is what we'll have to define. Whatever direction we want to go with that, we can have those discussions. But I just think the climate we're in now in EMS in the state of Georgia with the staffing shortages that everybody is facing day in and day out. And hey, I mean, we're probably doing more initial education than probably anybody else in the state, or at least what, top 3 or 4 in the state. I mean, we're just doing, I've got Crystal back there, we're doing EMT classes one after another. As soon as one finishes, we're rolling a second one.
Where did they go?
EMR classes. They're
I
going
think where a lot of
everywhere.
are going to the hospital.
Yeah, fire service.
I mean, the
You know-
Georgia EMS is supporting the hospital.
Yeah,
I'll
that's
be
right.
blunt with it.
Well, okay, let me,
And we're doing a paramedic program every year, but Courtney, where I'm going at is, you know, I've got people saying, you know, it's like you're spinning your wheels, you're doing all this training and all these folks are going everywhere else. And I said, well, I guess the good side of that is if somebody hires one of these EMTs from me, that's one less person I have to worry about losing to somebody else. You know, I mean, that's how bad that it is everywhere, but, and we're gonna continue to do it. And if I can get an occasional grant once a year or once every 2 years, I'm gonna reach out and take it, and it's gonna help minimally offset some of my costs compared to what we're spending. But that's the only way we're gonna get out of this thing, is we've got to that fly just doesn't know how close he is to this.
he's working his way around the room.
He's messing with the wrong person. He's your sharpshooter.
I just think we gotta focus on these staffing issues. And again, that's what I hear from my people in Region 10. You know, again, our council meeting, our tax, we brought this up and talking about money. And again, initial education and equipment grants is where everybody is focused. And so that's what I'm here to advocate for. You know, I know the skills labs are popular, you know, and like I said, the last time we met, I enjoy going to Six Flags, but that doesn't mean I think somebody should pay for me to go once a month. You know, and it's, you know, paramedic programs, we didn't have cadaver labs to do our training for innovations and whatnot when I went to school. And while I know that's convenient and it's appropriate, and for the paramedic programs to use that when it's there, I think if we do a class every quarter, people can sign up to use it from that. But otherwise, they're still going to find somewhere to get these skills done, just like we've done in years past.
Well, I mean,
We only do about 120 students. That's it.
I'm pretty strong on the cadaver labs. I really am.
I know they're popular, like I said, I
It's not-
understand that, but I think the
It's
money can
not,
better be
it's not
spent somewhere
popular.
else.
I don't care I care what's popular, but I also care about high quality education that they can't get everywhere. And I'm gonna be honest with you, I'm as frustrated with anybody with where we're at with staffing. I'm gonna spin off a little bit. I'm not leaving you. I'm gonna spin off. I spent yesterday afternoon about an hour and a half on this. I've been appointed by the governor to be on this healthcare workforce commission. So I spent an hour and a half yesterday with that group. It's interesting. They have a group, a state agency that looks after positions in mid-levels, and they have another one that pretty much focuses on nursing. I haven't seen anybody that really, from those groups that focus on where all the EMS people are. But here's my point with this. If we continue to train people and we can't keep them, then I don't have the answer other than it's a revolving door. And I don't know that all of them are going to hospitals, and I think some of them are getting burned out and leaving the profession because of the nature of the profession. And I don't know a change in that. I talked to one director yesterday, day before yesterday, we had a small group there, and he said he didn't have any problem with staffing. He said they did away with inter-hospital, inter-facility transports, and his people are happy. They're not getting up at 3 o'clock in the morning and take Aunt Sally to
Ask the
Memorial.
hospital how happy they are.
Do what?
Ask the hospital and the patients in the hospital how happy they are.
Well,
They're not.
first,
They didn't solve a problem.
Just
They
make
pushed
the
it
EMS
somewhere else.
okay. I don't disagree with you. I'm hospital-based. But in this particular situation, I don't give a dang about the hospital, because that hospital, if they had somebody with money or insurance, they were giving it to their friends at the private service who was in it. And if he didn't have any money, then they were calling the county service, y'all got to take this guy. So if you think I got any sympathy for that hospital, no, I don't. So I'm a popular guy right here. In August, I'm gonna speak to the Georgia Hospital Association's Rural Health Center group. And that's part of the discussion. Because I'm frustrated from the trauma commission side of it, when a rural EMS won't take a critical trauma patient to a higher level of care. And I'm getting word out, I'm hearing this mainly from the hospital community, it happens all the time. And the EMS community said it ain't our job to do inter-facility transports. And I think it is, but I think the hospital's got to come to the table too. You know, you can't expect the EMS to take the patient if they don't have pay while the hospital's making money. And I don't know all the answers.
Well, there's two parts to that. And one of them with the committee that you and now Pete are on to address some of this stuff. If y'all don't take this opportunity to convince the state that there needs to be a retirement program for EMS, y'all have totally missed the boat.
Then I'm
Because
off the
that's one
boat.
of the reasons why
Then I'm
people
off the
are
boat.
leaving the EMS. And the other reason is they're all overworked because everybody is short-staffed.
And it is a vicious
And
cycle.
so that's right, but we've got to address the short staffing. The only way we're gonna do that is educate our way out. On the political side of it, you know, and I know, Chad did a hell of a job for years, him and Kim working, trying to get something moving for a pension program for EMS providers across the state.
Can I
And
just-
while y'all were on this committee, Courtney, if this isn't the time to push that and say, guys, if we're not doing this, it ain't never gonna get any better.
What's going on is we are the first in the nation to do this. We are trying to do a retirement thing that involves hospital-based, private, and government. It's never been done. There's a study. We've met with some people up at the federal level. It has to be a federal bill that's going to be passed. We're talking with Senator Warnock. He's trying to find us the $70,000 that the company wants to do that study. Once that happens and it shows that there's a need, we can hopefully push that bill through to make it happen, that we can do a retirement fund that includes all three of those entities.
Right.
And once that happens, you can't believe all the other states that are sitting back waiting to bounce, because that's where we are right now. And we're talking with Senator Warnock.
No, I know, but
Sure.
again, with him and Pete being on that committee,
Mhm.
appointed by the governor, this is the best time to move forward with that and get the governor's office behind this.
I'm gonna pull us back into this meeting and you and I can have that discussion.
Yeah,
'cause-
but again, the other piece of that is we got to train folks.
I concur. We gotta train folks. So I don't, what I want to do today, if I can, and I think some of the things that you say we can pull away, I don't have a problem with. Okay, I think we probably can. But on some of them, the higher level courses that aren't done anywhere else, I'll vote against that. Because I think the cadaver lab is just that important.
I didn't say eliminate it, so we need to roll it back.
Well,
There's times to spend money on stuff like this, and there's times when we gotta focus on the problem at hand. And right now, the problem at hand is staffing.
well, I've said what I said,
I hear you.
and I won't support rolling it back. I'll put it that
But
way.
that's one vote, and that's just like me, I'm one vote, we can put it up,
There you go.
moving forward and see where we land.
There you go. So I don't know that I'm interested in spending the time to go back and do every one of these today. I do know we need to get contract out. So can we do that and just have a small committee get together and pull what here, there, and come back to this group? Is that a killer?
It's gonna stop us from moving forward.
Let me consternate on that for one moment.
I asked a question while she constipated.
Sure.
Not sure what that is, but enjoy it. If you need 7 minutes, take them from court. You don't think we could go through the list reasonably today and just get it done and be done so Kathy and then can move on and she can quit constipating?
Perhaps.
Okay.
So let me look at it this way. How many applications did you have?
Right at a little over 60, but like I said, I've got to go through and make sure that, we get technical schools that pop in, just hoping that we'll miss the mark. So I've got to make sure that they're all within the bounds.
Is that EMT or EMR?
Everything.
It's everything. It's ENT, EMR,
The funding is the same.
yes. Don't
Yeah, I
change
know
the
that. I just didn't know what people were asking for.
Yeah.
So
And if we
got
anybody next
60
for an eight-
requests, and we got 26 up there.
That's what, I put the question in. I said, if you were allowed to do an A and you could do it within the time frame that is already stipulated, could you do it? I had about 40 of them say yes and the others say no.
Okay.
So if we doubled what's up there now.
And whatever we didn't spend out of the, what do you see the line that says variable admin fee courses? Whatever we didn't spend out of there, if y'all gave me the possibility to bump that up into that category. And if you want to cut the tourniquets, that's 27,000 that we can bump. And that's 3.5 classes.
Yeah, one thing I have to check on the tourniquets, I don't know if we can pay, that might be a violation of the gratuities to pay the admin fee on top of the admin fee for the courses, so that's one thing we might have to, I don't need,
Well,
you
yeah,
guys, your vote on that, you just decide what you need to do with the other stuff.
it could be the same thing. If we bump that money up, then the admin fee would only be $834 per course as it's listed.
So if we doubled the amount of money going to classes, we would need to find 238,000.
If you double it, I mean, you got,
You said you had 60
You got
that applied and
26.
40 that said they could.
Right, well, it's 40 that said they could, and then remember, you always have that drop off amount that, oh yeah, we can do it, and not so much.
all right, can we go all the way to the bottom right there? Can you go, I don't think that, is that $30,000 at the bottom, is that the end of it?
No, it's 20, the very bottom is
You don't
20.
have to answer, I can just go up there and mark
Gina,
it.
can you go down to the bottom? There you go. So 27,000 for the 26.
Get it down so we can see as much of all that as we can.
Well, it would be the column on the right, wouldn't it? Because that 10% would go away too, right? The 29.7.
But then you would still have an admin fee.
You're right,
Yeah.
you're right.
So the other,
Hang on, she's trying to get the first couple lines, because you still got stuff at
That's
the
it.
top missing.
important about all
That's
of
it.
that.
Now it's down.
So. Still, EMT, EMR, we got 200. Is that 38,000?
216, 840.
Well, with administratively, you gotta consider that. Michelle will give that up.
It's $834 per course, and that's already over in the 21,684 that you said. It's just, that's put in there in case we do more ENT classes, that That's the admin fee per course on the EMT class, on each EMT class that we do.
So, so if we add more to it, you're telling me that the right-hand column wouldn't, if we doubled it, that right-hand column wouldn't double?
It should,
I'm sorry?
it should,
Okay, so that's the column I'll
Yeah.
work with. So,
248.
so Judy, what you're talking about is doing 52 of them?
Yeah, I
You
mean,
think
no,
you can do 52?
Yeah, we can do them,
We say EMT.
and then,
anything.
remember,
Yeah,
I
any-
can,
Any level up to paramedic or?
Anything they want
R,
to do.
B,
gives them a
A,
license
P,
because they do
any of the
$350.
above, people can apply for money to offset costs.
but you've got to get it done in our fiscal year.
Correct.
So sometimes the
So
paramedic,
paramedic would.
yeah.
No.
So,
Yeah,
and
We'll hold on just a minute. Y'all done jump time on me now. I'm not interested. If somebody's gonna take a paramedic class, no.
We just,
No,
we just.
no, no.
clarified.
Okay.
Up to
You're right.
paramedic,
So advanced back.
advanced EMT back.
RVA.
No. If they're an
I like
EM,
that RVA.
so what I'm hearing you say, if they're an EMT, you want to fund them to be an EMTA.
We will fund a class for an EMTR, an EMTB, or an EMT, as long as they meet the
Same money, same time.
deadlines. They would get the same amount of money regardless of which one.
Yeah,
they
the
apply for.
They, so yes and no. If they want to start from ground zero and be an A, I'm good with it. If they're already an EMT and want to become a bridge course, I'm not good with
Yeah, no bridge courses. That would be tough.
it. Okay.
What if the grant funded them to be an EMT and they were moving to the next level?
Tell them to write a check. I mean, here's the deal. You tell me the difference. If you got an EMT versus an EMTA, what's the difference in them
Okay.
taking care of trauma patients? What can they do? I'm sorry. So
Intermediate.
work with me on IVs for trauma.
They have to be an A.
You what?
They have to be
They
an
have to
A.
be an A, but how effective is that in trauma?
That's all you got. It's pretty effective.
I understand, but there's some pretty good science now that you start IVs and start giving a bunch of fluid. All you do is wash them out, they bleed pink and die.
We just need to get blood.
There we go.
A's can't give blood.
That's our-
You know, A's can't give blood. So again, help me with that on trauma. I'm good if they start the program from ground zero and go to A, got $8,400 to do that. I don't care. I'm looking for that initial license to get in
Well,
that
let me ask you
profession.
this, if you've got a patient, I know you like to talk about transferring the patients. If you've got a trauma patient that's being transferred that has an IV running, that needs to be changed out between Swainsboro and Augusta and an EMTB.
An EMT can't even ride.
Now you're taking your medical away from a basic call that it makes to the road.
That is a good point. That's a good point.
Thank you.
I'd like to see it, whatever outfit you set up a paramedic. I can't do that.
It's the RVA, it's
RVA,
EMTRs, EMTB, or
Even though we don't
EMTA.
have a B, that's fine.
Okay.
And technically, that's an ALS truck.
It
that's
is.
EMS. So
It is.
you're
Except
blurred
Georgia-
even more.
Except Georgia, ask Ben.
Yeah.
So if we're gonna double it, then we need to find $238,524.
So if we, like with you, if we take the junior leadership, 35,
Somebody got ad machine?
if we take the 30, I still believe pretty strongly in that.
If you carry this.
So who's running, you got the spreadsheet? Can you cut and paste these over to a different column?
Katie, you might need to share it and work your magic.
Gina's getting me bugged out.
And 100, that's 140.
It's not cheating.
I know, yes, no.
Save it.
Yeah, 35 to 30. Take away the tourniquet, those are 77. That's what the ads came like. Bring that down to 2, that gives you another,
I think you
20,000 there.
Work it.
reduce or get rid of the 88 for
Save it
the
later.
low ropes.
They're gonna have to start out.
So slow
Let's
down.
say only do one of these, oh,
Slow down.
okay,
So are y'all, is this a live spreadsheet?
Let's see.
It should be alive.
Yeah.
So what I'm suggesting that if you was in column, whatever, that they cut and paste those amounts.
Put something between E and F, Katie, would that help?
And Courtney said change 10 to 4 on the trauma scale.
You gonna
You
go
should have
get
come to
me.
the active
He's
lab.
gonna go
Gina
get-
was there.
He's gonna get me a
Wasn't it
Snicker
awesome,
bar.
Gina?
He's gonna deal with it.
See?
I did very much enjoy.
I think this travel skills labs are important.
Okay.
I'm not against, I didn't say cut them out. I'm just saying, guys, with what we're
We're talking about this
facing,
year.
I'm talking about allocation of money.
Take the
for
one
this
out,
past year.
take the one out of regions.
There you
There you
go.
go.
They're okay. After they're calling me.
They're okay.
The hospital. Okay, let's take away the 35,000.
Why is the hospital called?
If they love
You
it.
can just add the total, this is calling us for 35,000.
This copy and paste.
See, that's where it crosses the line to me.
30,000,
The next one, peer support, 30.
at the bottom, the 27,000.
Courtney, watch out with the trauma, skills labs that are coming off the trauma commission, man. Since the hospitals and everybody else are going to.
That look on your slate.
Vic, you two, you two are the trauma commission. I mean, they're not important. Trauma commission money.
There you go. We'll pay for 4 of them. And they
Yeah, they
can
pay
pay
for
for
those.
The actions of leadership. Take that
I'll
down.
put you on the agenda for the next trauma commission meeting.
So,
We tried something like that.
We have had that
20,
discussion.
42,000 is what that would be.
They don't let me,
Yes.
don't let anybody come sign a permit.
For the patient, low angle roads. Let's only do one class of this, so that's actually the wrong number right there.
Find that money for us. I'm tired of leaving to the hospitals. I mean, this is.
This should
Yeah, we become EMS licensed professionals.
Uh-huh.
Outside of the ground and area.
Can you sum that at the bottom so we see where we're at?
On that column.
That's getting us, around 120 or so. Is that what I come up with?
Well, also. Human calculator. Whoa.
Oh. You're gonna have a hard time getting past that there.
Yeah.
And what is that first one?
Auto sum and pop it up.
It won't do it.
How about change some of the
At
TECC
5,
classes?
At 10,
Let's see where we're at, but I'm not gonna get that. GECC classes are not one of my favorite classes.
So if you reduce them by about 50%, you can get it. Oh, there you go.
There you go.
So now we're getting close to 140,000 with what y'all just added.
and Katie, their approved budget was actually 1.7.
Yes, that's what I was about to say, that you guys have an
So we've got a little bit more money, then we can do 2 more classes at 8,000, yeah.
There we go.
Okay.
100.
And say,
And then
our
add-
budget was 1.7.
We got just under
Another 17,000. That's 2 more classes. Oh, my God. Lawrence is huge, he wants to kill you.
On 67.
That should still work out for the same thing. Yeah. Yeah.
Let's drop 5 of the GECC classes.
8,800 times 5.
We're TECC,
Not bad.
drop 5.
If you put 5 in there, I think it
Under
calculates it.
30.
Okay.
Now
Well, I'm not, I don't want to change her,
Okay.
her original.
It's 211,000.
Plus another 17 that,
She already
is
had.
not on.
I added that at the bottom.
Oh, okay.
So we're at 211 and we're shooting for 38.
And knowing that, every class is not gonna spend the full allotted money. That's why I always add over classes.
I think, Yui, I believe we could,
Do
I
that.
believe we could double it without amount,
Mhm.
unless you really want to take the cadaver lab out of Region 10. I'll
And it was one
certainly
of our
put it in the
biggest-
Athens paper that you did that.
Hey, you know,
I'll comment on the cadaver lab. They train a significant number of initial ed.
no, I know.
Specifically the paramedics.
That's what I said. I didn't want to do away with it.
Yeah.
I just said scale it back for now and, you know, we can get back to that number in the next year or two. when we
So-
are-
It
On a
was just
scale of
you
1
can't
to
We are
10,
go to
funding
the
paramedics
ORs.
still.
They can't go to the ORs now and get their skills.
on a scale of 1 to 10, 10 being absolutely you're certain of it. If we added that, Chase made that change and added 214. 240, what's the hell that is?
211.
211, 853.
I'm saying I could put out 50, I could start out with 50.
That's 5
Initial-
per region.
That's, put out 50 of them. And then see where my money sits and, you know, because I try to get the initial roster in first. Once I get the initial roster in, I've got a real good clue how much money I'm gonna have left over from that class. I'll go ahead and reach out to the next person that I've got on standby on that list.
Now,
So
do
it's-
y'all have a pool of instructors that y'all will reach out to as well, or how's that work?
For EMR EMT.
Yeah.
That's one of the things I asked for on the initial application. I asked who is gonna be your lead instructor and who is their contact.
Because I think that's where, Richard, we can come in, like Ryan in Region 10. You know, our regional coordinators can work with the money that we have to teach these classes. Our coordinators can get with our local instructors in the regions to help put these classes on and be a resource for all the providers that may or may not have their own instructors.
So,
I utilize
so
our
if you
region
average,
coordinator a lot for the classes that I teach.
Yeah.
Jonathan is real well about coming down and helping me do stuff.
so if you
anytime I
average
need-
20 students
Well,
per,
Ryan's
that's
real
1,000
active.
students.
Region 10, now we have an active. you know.
And there was some, I think it was one of Lee's classes, Rob. I knew that I had some to play with, and I think y'all had like 35 in a class. And I told Rob, I said, you know, I can borrow from Peter and pay Paul, because this class only has 10. Go ahead, I'm gonna fully fund that class and for all of your 35 people. So I work like that, seeing how many more we could publish, but get out there, all about education.
So can we change that line to say EMR, EMT, AEM2? This, because this stuff gets spread all over. Just for clarity, for this next year, I didn't say paramedic.
You're giving him a twitch.
AEM2. Don't put D.
No,
Don't
it's
put-
not.
Yeah.
Tell me in there.
Oh, we have a joiner.
I want you to tell her I said.
Yeah, tell me, just put.
I am clear it's an EMT.
Talk about MTV.
I am clear.
So I was just kind of wanting y'all to have some skin in the game instead of just the commission, but, anyway. If you want to put A in there, that's fine. I do what? Just understand, y'all pushing the envelope with me really hard here right at the moment. That the goal of this whole program had been to make sure that we had enough people out there in areas that had huge distances and timeframes to get there, so that somebody could stop bleeding and open airways so that those people would survive. I can't help where we're at with our profession, but I'm very, very frustrated with our technical colleges and other institutions and their support for training EMS people in the state of Georgia.
So with, I will say this, I agree with you. When the state came up with the EMTV years ago, I was the one beating the drum saying, this is stupid, we don't need to be going backwards. And here, I'd give a left arm for an EMTV. I mean, it's just the time.
You wouldn't get but one.
I know, but I'm just saying, that's the times we're in, and nobody wants to be putting EMTRs on an ambulance. But there is no option, and that's why we've got to train our way out of this. That's the only way we're gonna get out of this, and again, with the committee that you and Peter are on, I know that's another discussion. I think now's a great opportunity to put pressure on the governor's office to get EMS where it needs to be recognized, not just here in Georgia, but across the country, and get people in this profession, in a profession they want to make a career out of and stay in and retire from.
Well, I really, and honest to God, truly don't believe you're losing medics because they don't have a retirement fund.
I guarantee you I'm losing people for pension programs.
I don't doubt that you're doing that, but I doubt that the pension fund is the primary reason they're leaving.
I don't think that's a leading cause. I think the leading cause is we're paying them.
But I want to get finished with this meeting and I'll stay all afternoon if y'all want to talk about that, because I've had two
I got another one
focus
in there at
sessions.
2:00.
I've got one at 1, so I got to get out of here, but she can call back later. So does everybody understand what we got here? Is there any question here? And I'm entertaining a motion to approve the spending plan as we have got it up here.
I'll make a motion.
I'll second this motion.
I got a motion and a second. Any discussion? All in favor, aye.
Can you send it to me and then I'll send it back to you?
Yeah. All right.
Motion passes.
Thank y'all. Thank you for the funding and thank you for the education that we're gonna deliver. And I'm very, very appreciative of it. And that's, you know, I'll drag Keith into it, 30 years into it, and he can retire and go somewhere else. But nobody was here to deliver this education for us when we were young. And just being part of it and able to pay forward and still be engaged. Thank you. Thank you for the opportunity. Thank you.
Okay, thank you. So EMS equipment grant, 911 and general transport. I still am not where I want to be on this until we can identify the trucks that are general transport and not fund them. I'm concerned. And until we can figure out, and I may set up a smaller committee to look at this and try to figure out what we can do there. I'm very concerned about rural Georgia and those services that have not stood up. Hanging blood, I pick on the state office, should have never been a post licensure skill. They trained me to do that in 1976. Okay, it is not difficult hanging an additional unit of blood. Having said that, it is what it is. It's not rocket science. I think we spent 6 or 8
They
hours.
trained you that along with putting on mask trousers, right?
They did, and you know what? You know what? I still believe them. Because I had a guy who was in cardiac, who was in a code situation. I put mask trousers on him. We got him to the hospital, started blood, and well, I don't know, maybe dead now, but he lived for at least 10 years after that. I really think mask trousers got a bad rep when hospitals took them off abruptly and killed people. And anyway, that's a different discussion too. So I'm gonna set up a smaller committee to look at that. And should we do what Huey's talked about for decades, about this is what you will buy if you get the grant. This is what your focus will be. But I see a definitive difference in focusing between rural and urban areas that have that level 1, level 2 center in their community. So anyway, that's where I'm gonna be with that. Immediate transport from non-trauma hospitals. I am working with a hospital association. I'm doing a talk for them. My talk is hopefully designed to get the hospital administrators and the hospital leadership and nursing leadership to have meetings with the EMS people and try to figure out where their issues are. And I don't know how much of it is drama or miscommunications or what, but I do get enough comments. I've already had one meeting with the ACCG leadership on it. They're looking into it too. And why is this happening? I sometimes know that they just flat don't have trucks. But I will be very honest with you, I'm desperately concerned about services who said our policy is we always have an ambulance in the county. And while somebody's bleeding to death in that rural hospital, that ambulance is sitting there waiting on Aunt Sally to fall and hurt her toe.
And Courtney, I know you've got to focus on it because of the trauma, but I assume you're hearing it also for stroke and stem.
I am,
Mhm.
I am.
So it's all the acute levels, and the higher levels.
It's time-
You just got to focus on it.
This time sensitive, critical nature is where I'm coming from, Lee. But we focus on it.
No,
because of
I just
trauma.
want to make sure
Yeah.
that
Yeah.
it really wasn't a subset.
You know, it's.
I hear it, that it's all those
Yeah.
strokes, it is trauma.
All of the above, so to speak. So learning management system, I don't have an update. March Pauls, I do. That is my 1 o'clock, supposed to be talking to a lady named Casey Bridges. So we've had several meetings concerning March Pauls. We initially when we got the grant, the concept was that we would do a class, everybody come to the class. It would be EMS people, physicians, nurses, so all of them trained the same way to try to break down the barriers and make sure everybody understands the current knowledge base on critical trauma. And the March Pauls acronym was developed by the military. What we found when we did the initial stuff in Lake Blackshear was it was heavy on military, heavy on tactics, tactical emergencies, multiple patients, and this sort of thing. And many of us felt that that was a little too military. So we've got a group that's working to try to focus that more on what we do in rural Georgia, urban Georgia, everywhere in Georgia. And so that we can put out a good product. One of the concepts that came up at that Lake Blackshear thing was, can we do some of this online? And so that particularly the physicians who would like to help teach it or would like to help be in the class, need to be in the class, their time frame getting away and doing that is difficult. And as y'all say, sometimes it is for the medic. So Ms. Bridges is an instructional expert. I'm hoping to also engage someone who is an expert with a Moodle platform because we're interested in putting it on the Moodle platform. So the plan right at the moment is to get a contract with her to meet in the next few weeks at Mercer with her and those folks that we worked with initially to work through this curriculum to get it where we think it needs to be. The next step will be to do the program at Emmanuel Medical Center. Y'all know anybody who works there?
Well, as far as working, I'm not sure. I don't know somebody.
Great point, good point. But we have a team that's pretty dedicated to that. We did get the grant. The second, that would be the first blush, so to speak. The next class will be over at Cordele. That's our plan. Dr. Register, who's very involved, she's a trauma surgeon over there. We'll do it with that group. And then we'll go down to Thomasville and do it at Archibald. That's their center there. That will be the last draft, so to speak. And if that works out, we hope that it will, then we will have the physicians and other experts doing the videos so we can put that on the platform. So the concept as it stands right at the moment, Liz, listen to me and correct me if I'm wrong, that if you want to take the March Pauls, and one day that probably will be part of our equipment grant, that you have to have that class, that you go on to take it online. And it will be interactive. So every few minutes you're taking some kind of exam to make sure you're not just floating through it. There will be some way to make sure that you leave that course and having gained the knowledge that we need for you to have. And then after that, you would go work with a group of physicians, nurses, and medics to do the practical skills. I'm thinking through this, and we'll be discussing it with the group. Most of the practical skills that we're dealing with, I think people already know. I think the teamwork is more important, and the communications is more important than the practical skill sessions. Questions about that? I have kept you far too long. Let's see here. So I am going to suggest that we adjourn. If anybody wants to stay around with me and Huey, bring your pocket knife. I will not own you mine. We will have a discussion. I am, in all seriousness, I would love for you to hang around a few minutes and let's talk about this group. I've met with some of the GIMSA leadership last week. I met with some of the rural services around Emmanuel. They came over to our shop the other day. Kelly's kind enough, she's setting up a meeting with some of their staff. I'm very interested in hearing what your thoughts are about what this group can do. You can go on, I think I can send you there's a website for it. Our session yesterday was recorded, so you can hear what was said. Love to have your input. All of you know how to get in touch with me, I think.
Where do you find it? Where would you find the recording?
I'll go back, Lee, and there is a specific website for it. And they set up. You could probably go, Casey Noggle, who is a commissioner, Department of Community Health, is the chair. You can probably go on their site and find it, but I'll go and look and send it out to everybody, a link.
That'd be great.
But sessions, the next session will be, all the rest of the sessions will have an in-person component, but you also, they have a Zoom capability. And if anybody wants to zoom in or come to there's going to be 2 sessions that they're asking, they're inviting stakeholders to come. So I definitely want some of the EMS stakeholders to come. I will entertain a motion to adjourn. All in favor can get up and go home or hang around and talk about workforce. Thank you very much. I apologize for taking so much of your time.
Hey, Huey, Courtney shares his